Hi friends, welcome once again to Living the Journey, the podcast. I want to say thank you, and it has been an honor to be part of this journey. For our next season, I want to hand over the baton to our colleague Zaira. She will be guiding you in this process and in the next episodes. So let's welcome Zaira Burns.
Thank you, Andrea. I'm very happy to be here and as well to continue this journey. Hello guys, welcome once again to Living the Journey, the podcast. Today we have an interesting topic that I know you may have a lot of questions of, and that is PGT-A testing. Today we have very special guests that are our medical team and our LIV Fertility experts. Let's welcome Dr. Isabel and Dr. Aline.
Hi, thank you. Welcome, Zaira.
Thank you, Zaya.
Let's start straight to the questions. What specific criteria guide the recommendation of PGT-A, and in which scenarios is it considered a crucial component for patients undergoing IVF?
Well, the PGT testing is based on specific conditions. For example, when patients get older, more than 38 years old, it's recommended. If the patient has a history of alterations in previous babies, or if the couple has a history of a disease, a genetical disease. I think that is the most important.
How safe is the PGT-A procedure, and what are the risks associated with the manipulation of the embryos?
The PGT-A process is generally a safe process because it's performed by experts. So the minimal chances for example, lose an embryo is less than 5%.
Okay, doctor, and from the initial consultation to the embryo transfer, what is the timeline expected for the PGT-A process?
The entire process of PGT, it's different in each couple, depends on the factors, depends on the stimulation and on the age. So since the beginning of the stimulation until the embryo transfer, it's different. I would say that probably 6 to 8 weeks. So first phase, that it's the stimulation, lasts around 10 to 12 days. Then we have to create the embryos and wait until day 5, that is the blastocyst stage, to perform the biopsy. After the biopsy, we need to wait at least from 4 to 6 weeks to have the result and decide which is the embryo that we can transfer.
Could you tell the difference between conventional IVF to an IVF with PGT-A testing?
In a conventional IVF, the embryos that we transfer are not genetically screened. In a process with IVF and PGT-A, we are sure that we are transfer healthy embryos. So this increases the possibility to have a healthy baby.
How does choosing PGT-A now impact on planning children in the future?
I would say that in couples that are below 35 years old, for example, talking specific about a woman before 35 years can freeze the embryos for the future without any problem. The PGT is not strictly recommended in this group of patients, but after 35 and specifically after 40, if patients are seeking for a pregnancy in the long future, it's recommended to be sure in the future that we are going to transfer a healthy embryo.
How many embryos need to be analyzed to determine their suitability for the transfer in the PGT-A process?
Okay, the number of embryos analyzed during the PGT is different in the couples. So when the patients have more than 40 years old, it's important to have more embryos to analyze for make sure that we have at least one healthy embryo.
After the PGT-A testing, what is the time we need to wait to proceed with the transfer of the embryo selected?
Well, after PGT-A, we need to wait at least 4 to 6 weeks, as I told before, because we need to wait the results of PGT. So since the day of the biopsy, it takes 4 to 6 weeks, and that period of time gives us also opportunity to study the couple, to prepare the patient before an embryo transfer, to give her the treatment that she needs to be ready for that, and also to know the diagnosis of each embryo and choose the better one. choose what is the best option, transfer one embryo, two embryos. We recommend a single embryo transfer when we have an haploid embryo, unless the couple decide having twins, for example.
Can you tell us how patients commonly react to PGT-A results? And how do you emotionally help them as a doctor?
Patients may have a lot of emotional reaction with the results of the PGT, especially if the results are aneuploid embryos. In this case, LIV support to the couple for examining other options. For example, donor eggs, or according to the problem, to the issues, we can determine what is the best option for couples. We provide guidance with this sensitive phase of the journey. We can try other treatments of this process for get a pregnancy.
Well, thank you, doctor, for being here and sharing this important information with us.
Thank you so much.
Thank you.
Well, we already heard the values information the doctor shared with us. Now we will forward on with our lab team, Carla Martin, our lab director, and Fernanda Renteria, our embryologist.
Thank you, Zaira. It's a pleasure to be here again.
Thank you, Zaira. So, well, let's start with the questions. What is PGT-A and how does it differ from other genetic testing procedures?
Sure. Well, first of all, let's define what PGT is, okay? PGT refers to pre-implantational genetic diagnosis, which involves the genetic analysis of embryos that are created during an IVF cycle, okay? There are three types of genetic analysis in this case: PGT, PGT-M, and PGT-SR. Those are focused especially for those patients that are that has a history of a genetic disease, a specific disorder. And the other one, which is the one that we are going to talk here in the podcast, is the PGT-A. This is focused on the healthy status of the embryo, the overall genetic status of the embryo. Then PGT-A identify the number of chromosomes in the embryo. That way we can choose better embryos and increase the success rate.
How does PGT-A increase the chances of a successful pregnancy during the IVF?
Usually we have enough information in the laboratory, taking into account the morphology of the embryos and the way that the embryos develop. So this is the main information that embryology has in order to select an embryo for transfer. However, with PGT-A, we have a plus. We can now know the genetic information, the healthy information of the embryo, then we can increase the pregnancy.
At what stage of the embryo development is the PGT-A performed?
Embryo biopsy can technically be performed at day 3 or day 5 or 6 at blastocyst stage. However, it is currently unnecessary to perform it at day 3. Ideally, embryos should be taken to extended culture, and only those embryos that reach the blastocyst stage should be biopsied, since these embryos have the greatest potential to achieve a pregnancy.
Well, at LIV, what we do is the second option. I mean, for us, it is considered already obsolete to do it on day 3. I know that probably there are some laboratories that still do it, but we have all the technology, all the expertise in order to do it on day 5, and this is the better option. So we do it like that.
What specific chromosomal abnormalities does PGT-A screen for, and why are these important in the context of fertility?
Okay, first let me give you like a background of genetic. The genetic information or the DNA are organized in chromosomes. We call like that chromosomes. Every human cell must have 46 of them. So the PGT-A, what does is identify the number of chromosomes and tell us if there are extra chromosomes or if missing of them. That means that the embryo is normal when the number is correct, and abnormal, what is less or more of them. If we can know this information, we can avoid to transfer embryos abnormal and then reduce miscarriage rate, means especially on the first trimester of the pregnancy, we increase the potential of the success rate, the potential of the embryos, and we avoid also congenital diseases, especially related with malformation on the liver and intellectual disabilities, for example, Down syndrome.
What happens to embryos that are considered as abnormal during PGTA, and why is this distinction made?
Well, abnormal embryos are not suitable for transfer, so because of the risk Carla mentioned before, and normally these embryos are discarded. There is a possibility that the embryos may be reanalyzed. However, this decision needs to be discussed in each particular case.
How does PGTA contribute to gender selection?
First of all, we are going to know the number of chromosomes, right? Then we are going to identify the sex chromosomes. Therefore, we can know the gender of each embryo. So this is the reason PGTA has become widely used method for gender selection. I always recommend our patients that choose PGTA to be performed for gender selection that complement this technique with another gender selection that is performed directly in the sperm sample. For example, Erickson method and microsurvey. I'm pretty sure that we are going to have very soon a podcast regarding this. I don't want to deep in this subject. If we combine these methods with the PGTA, we enhance the possibility to have the desired gender. As always, there are many techniques that we can use or perform in IVF. We have had a podcast regarding the add-on in the lab and all that stuff. However, it is important that you discuss this subject with your doctor, or LIV doctors are going to explain you better if this is the best option, which one for you, because not all the techniques are the best for every patient. So we are going to follow or give you options, the best option for every patient.
Can PGTA detect single gene disorders, and how does this increase the chances of a healthy pregnancy?
No, PGTA only detects number of chromosomes, but not really a specific gene related to genetic disease. For example, there are specific disorders that are linked to a specific gene. For example, cystic fibrosis, Huntington's disease, hemophilia, etc. And for these diseases, the PGT-M test is needed. However, PGTA and PGT-M can be combined, but patients need a genetic counseling.
What is the role of high-tech laboratories, and how does it help to make the results more accurate?
It is more than obvious that having the most advanced technology will allow us to have the most accurate results. At LIV Fertility Center, we have the most advanced technology, and we work with laboratories specialized in reproductive genetics and recognized worldwide.
How do they make sure that embryo biopsy is very accurate in the PGTA?
Well, there is no perfect laboratory techniques. However, PGTA has an accuracy here in LIV over 98% because we analyze the samples using the most advanced technology, which is next generation sequencing. It definitely requires experience on the part of the laboratory staff to be able to perform one of the most complex procedures in reproduction.
What developments and trends are emerging in PGTA, and how does LIV Fertility Center stay current with this development?
Currently, the technological advances in reproductive genetics are focused on creating a PGTA method that doesn't require embryo biopsy. Of course, right now, in order to have the genetic analysis, we need to do a hole in the embryo, take some cells, which is the biopsy, and send for analysis. So the idea is to have a method, non-invasive method, that allows us to analyze the culture media where the embryo is growing. Then there is no manipulation for the embryo. The method exists. However, right now we haven't achieved the accuracy that we have with the PGT-A, the normal PGT-A. So this is we are focused on that. At LIV it remains at the forefront, and as soon as this be feasible, we are going to offer to our patients. Just to emphasize that PGT-A is a strong tool for us and allowed us to select healthy, genetically healthy embryos, which is valuable information in order to increase the pregnancy rate. Also, as we mentioned, for gender selection. The most important thing is that, as every technique in IVF, it has to be discussed with your medical team, with the expert at lab. You are going to take the best decision for you.
Well, thank you, Carla and Fernanda, for being here and answering our questions. We hope to see you in the next episode.
Thank you so much.
Thank you, Zaira.
And for all the people that is watching us and is interested in performing an IVF treatment with PGT-A testing, we are always happy to help you and assist you during this process. My name is Zaira Burns, and I'll see you until the next time.